Hello, I'm Dina Jackway, Parkview's Chief Administrative Officer, and welcome to another episode of Parkview Connections, a podcast geared to help our Parkview coworkers connect, learn, and grow. Our goal is to inspire leadership and influence, and we'll meet coworkers and leaders and hear stories of bold leadership that both engage and encourage us, that help shape this world-class culture and teamwork that we have here at Parkview. So I'm happy to be joined today by three of our Parkview nurses who were all instrumental in helping us achieve our most recent Magnet redesignation. So I'll introduce Julie Johnson, who is our Chief Nursing Executive, also Vicki Babb, who is our Director for Nursing, Clinical Center of Excellence, and Magnet. And then we also have with us Naomi Adamski, who is a nurse in the OB area at Parkview LaGrange. All right, Julie, let's start with you. So you are leading a third of our workforce. When you think about the number of nurses that we have out of our 15,000 coworkers. We talk about bold leadership in this podcast a lot, recognizing that nursing is that profession that has this amazing privilege of walking our patients through so many journeys. Some certainly positive, and then certainly some of the darkest times, unfortunately, but it's also such a gift. How would you describe, for those that, what is a Parkview nurse? What does that mean to you? And for certainly those saying, I might want to become a nurse, what does it mean to be a Parkview nurse?
For me, to be a Parkview nurse means that you are the best of the best. We just received Magnet, the highest nursing accolade you could receive, but it means that our nurses have the best patient outcomes. They provide the best patient experience for our patients and their families. And you're right, we walk with them during some pretty tough times, and we have that honor and privilege, as you said, and there's not too many professions that allow you to do that. So we take it very seriously, and we feel very blessed to be able to do that.
So when you think about challenges and certainly nursing from a profession, what are some of the challenges that you've seen just in the last couple of years?
Especially in the last couple of years, national nursing shortage. So that challenge in itself, my number one priority is looking at the nurses we have, keeping them at the bedside or wherever they are working, and making sure they have the resources that they need to continue. The last couple of years have been very hard, and we just need to make sure we're providing them all of the support in the world. And then the other challenge is the recruitment piece. So what can we do to partner with our universities and our local entities and to bring nursing to Parkview and want everyone to choose us for their nursing degree and career.
Yeah, I love that. And just knowing on the HR side, the HR team has shared a tremendous number of efforts along with nursing around how do we partner with schools and universities, to build the programs, but also just new ways to recruit nursing. I mean, I love some of the creativity around the ideas that have been shared, because it is all around how do you create that pipeline, not just for today, but for generations to come. So what's the best leadership advice that you have ever received that you want to impart on the audience?
I have been so fortunate to have the best leaders and mentors throughout my career. And it's not exactly what they've said to me as much as how they've led. I can sit back and I watch, and I've learned more from the people that I've reported to. And just for me, it's all about leading with integrity and humility and being authentic. I'm completely transparent. I want the people to know that I lead, that I care about them, and I want to make sure that I am giving them everything they need to enhance or improve on their career choices or advance if that's what they so choose, but create that greatness around you. I think that's so important.
I think, Julie, just as your background as a president of one of our community hospitals and coming into the nursing role, you already have such great background and knowledge, both on the operational side, but certainly as a nurse. So thank you for answering the call and taking this leadership role and helping lead our nursing all across the organization. All right, Vicki, so thank you, because I know you have been instrumental in helping us lead the Magnet journey. And this is not our first time with Magnet. This was our redesignation of Magnet. For those that maybe aren't familiar with Magnet, if they're not in the nursing world, how do you describe Magnet?
The Magnet accreditation is an international accreditation for nursing excellence. And so when we think about nursing, it's the clinical outcomes, it's the nursing at the bedside who are taking care of our patients every day. It's their patient experience. It's how our patients experience the care we provide. You know, we always hear about the numbers, you know, and the data, but it's connecting those clinical outcomes to the why, that patient. Why are we here? And I think for me, the Magnet journey and why I've been so engaged in this process now since 2015 when I moved into this role is telling those stories of excellence. And I think that's truly what the Magnet designation says to us. And that says so much about what not just our nurses do, but our coworkers, the 15,000 coworkers we have, because nursing can't do it by ourselves. It takes that village and that teamwork and that family to really build the culture needed to have a Magnet accredited, Magnet designated organization.
So I'm going to put you on the spot a little bit, and I know you may not know this number off the top of your head, but with those many hospitals, how many systems?
We are one of the largest systems. We are considered a legacy system, which means all of our hospitals at one time that were in the system when we went for our first accreditation. For our second redesignation, each hospital stands alone, which means we did 7 documents, 7 site visits, and every hospital had to meet the same rigorous standards, whether it was one of our critical access hospitals like where Naomi practices, or our major medical center of the regional and affiliates. So it just says that no matter where you go in Parkview, you're going to receive the same exceptional care.
Is there a story or a moment that just throughout this most recent redesignation that sticks out to you as just something really special to help describe that journey?
The story, no matter where you go across Parkview during this journey, during the past 4 years of writing stories to meet the standards, were our patients and the exceptional outcomes that our patients had, the feeling of family. Even when our appraisers came to our hospitals for the site visits, the theme they heard, no matter where they were, no matter what unit they were on, was that feeling of family, that our nurses, our coworkers, the physicians, everyone worked together to provide the care to our patients. So I guess to Julie's point of, you know, being a Parkview nurse for 40 years, nursing is a privilege. And I think that our nurses, our coworkers, that has been so instilled within the culture that we have at Parkview. So no matter what story we told, whether it was about, you know, the emergency light at the entrance to a hospital or the patient family advisory councils and how our staff and nurses worked with those patients to improve care, or the pandemic, our baby-friendly designations at several of our hospitals. It's just those stories and how they come to light throughout meeting the standards for Magnet helps our nurses know and remember all those great things we do, because we believe it's part of who we are every day. That's what we do. Magnet is just what we do every day. And I think that's what's so cool to be a part of.
That's really well said, and really it's that there's such power in stories, because it really demonstrates our culture.
Very much.
And who we are, not just within nursing, but certainly the whole organization.
Exactly.
Okay, Naomi, it's your turn.
All right.
So you are an RN in the OB department at Parkview LaGrange, is that correct?
Yep, that's correct.
But you've also taken on a special role as Magnet Champion. So tell us a little bit about what that means.
A Magnet Champion is a clinical nurse. Each clinical area has a Magnet Champion, and we are provided with additional information about Magnet. We do in-depth education regarding Magnet standards, the data that's looked at, what it takes to achieve Magnet, and then we go back to our units and share that information, not only with the other clinical nurses, but with other staff members, because like Vicki said, it's not just nursing that achieves Magnet, so we share that information with everybody from housekeeping to facilities, dietary, and just help spread awareness about Magnet. And we also champion the voice of the nurse, the clinical nurse, through things like our NCAT, which is our Nursing Clinical Action Team. We help spread awareness about evidence-based practice, nursing research, and all the opportunities that are available to clinical nurses at Parkview Health. And then we also, during our site visits, act as ambassadors for the appraisers that come. We help Vicki with writing stories sometimes, and just making sure that everyone's ready for when the appraisers come to do our site visits.
The NCAT team, can you say a few more words about that? Just for someone who's not familiar with what the NCAT team does, only because I know there's a tremendous amount of work that goes into that, certainly from the nursing side. So giving a shout out to that NCAT team.
So the NCAT team, that stands for Nursing Clinical Action Team. So that's led by clinical nurses on each unit at Parkview Health. So we take on projects on our unit, things that we see that could be improved on. It's the voice of the clinical nurse, so when we see something, we don't just say, well, we're going to leave it because that's how we've always done it. We say, let's see how we can improve this. And through our own leadership as well as our leaders at the hospital, we're able to make changes and really improve the care that our patients receive.
Just Magnet and how integral it is now within our environment. People, they've heard it, they understand what that means. What does it mean to you to work in a organization that is Magnet designated?
It means a lot. I think it's a huge achievement for me personally as a nurse. I take a lot of pride in that, and I think that we do across the board. Magnet isn't something that we achieve and then we forget about until the next 4 years with the next redesignation. It really is what we do every day. We've said that all along since 2015. We've been achieving these standards since I started at Parkview Health in 2011. So Magnet is really the recognition of that. It's the external validation of what we're doing every day as nurses. So I think it shines a light on that excellent care for every patient every day that not only nursing is providing, but the whole team. And I think that Vicki and the other leaders have done a great job of showcasing that it's not just nursing, it's all of us working together to achieve these outcomes. For me personally, as a nurse, I've experienced a lot of growth through my time as a Magnet champion, through mentorship of Vicki and Julie, and before Julie, Judy Berger. So I've been provided with some amazing opportunities and growth that I don't think I would have had otherwise. So Magnet is boundless opportunities for clinical nurses. I think it represents that dedication from Parkview Health to the clinical nurses, that if there's something you want to do, if there's something you see that needs to be changed, could be improved upon, you have a voice, you have the ability to bring that up, and it's well received, supported. It's go forth and conquer, and just showcases all the things that we can do and how amazing our nurses are.
That's perfectly said, actually.
Thank
Because
you.
when you think about just as an organization, the growth, that continuous professional development is so important. You know, I appreciate that you've chosen to all be Parkview nurses, and you're helping bless this organization in such incredible ways. Thanks for being here today and sharing.
Thank you.
So we heard a lot of great stories today, and really these three ladies helping us, this is how our family takes care of others. This is creating that story of care that happens over 3 million times a year across the system. So grateful to have all three of them here today to share the stories. Thank you again for tuning in to another episode of Parkview Connections. And as always, please keep those emails coming or feedback in other topics that you'd like to see. Today's topic, in fact, did come from one of our team members asking to hear more and learning about nursing. So we take those suggestions very seriously. We'll see you next time. Thanks.